Okay, so when you're doing air conduction masking, you're looking at the audiometer. We have the tone side, so I have it on the right, and then the masking side, so I have the button here on the left. And you're going to look to see that NB for narrowband is lit up. And then when you are going to present masking in that left ear, you're going to go ahead and click rev on the right side of the audiometer. So when you are going to up your masker, you're just going to use the dial on the right side as you continue to go up.
So we're going to work on some air conduction masking. As we've been doing in labs, we're going to reference this audiogram that is in the lab room. So I'm going to use this to do some air conduction testing. The first thing you want to do after you get your air thresholds for your right ear and your left ear, you're going to go in and at every frequency, see if there's a difference of 40 dB or more to determine when you're going to have to mask. One frequency I can see already that we're going to have to mask is 2000 hertz. So you can see that there's a significant gap between those two, and it's over 40 dB, so we'll mask there. So now that I know I'm going to mask at 2000 hertz, I already have it set up to 2000 hertz on both sides, so we're ready to go. My test ear is going to be the right ear, and my masking is going to go in the left ear. Remember, we already figured out that we have to mask, so now I need to determine how much masking. So I'm going to look at 2000 hertz, and in the non-test ear, the response was -5, so I just always start there. I can only start at 0, so we'll just start there. And then I'm going to add 30 dB to my -5, so then I would start at 25 dB of masking. And then on the right side, I'm just going to set the audiometer up to their non-masked threshold, which I'm guessing is about 35 dB, and that's where you would start your masking procedure.
So once you have already figured out how much noise you're putting in the left and at what presentation level you're starting in the right, I'm going to go ahead and put rev on, and here you can see I have the noise presenting in the left ear. I'm going to leave it at 25 dB, and I'm going to present the tone at 35. So they responded, so I'm going to reestablish threshold. And they got it there, so we know that is all we need to do for the step procedure.
Okay, so after your air conduction and your air conduction masking, you're going to move to bone conduction. Go ahead and get your unspecified bone first, and then you will mask, determine if you need to mask, and then mask to get your specified bone thresholds. So looking at this, I'm going to see that I'm going to have to mask my mask in my left ear to get my right ear thresholds, just to be sure that that's a conductive loss. So again, I'm going to use 2000 hertz as an example, and so we'll be testing that frequency, testing the right ear bone while masking the left ear. At this, I'm going to figure out where to set my levels to start off with. Since I'm going to be testing my right bone is selected here. To start, I'm going to put my level at where the unspecified bone was, which was -5. To start off with that side, and that side is good to go. I don't need to touch anything else there as of now. And then to set up my left side is where I need to do a little math to figure out how much masking I need to put in. Remember that for bone, you're taking the air conduction threshold of the non-test ear, which is -5. I have it set to 0 because that's the lowest it can go. Plus your OE for this one is going to be 0, and then plus 10. So I'm just going to add 5 in there for my masking because we started at -5, remember. So now I'm just going to go ahead. They've been instructed, so I'm going to go ahead and turn that masking on. And then go ahead and present on this side. They got it, so I'm going to increase the masker. They got it. And one more. And now I'm just going to reestablish my threshold. And they got it at -5 because that would be your masked threshold.